REC. Training in resuscitation is important for all the dental team and must be practiced regularly under supervision. But it's not the only way in which a dental practice needs to be prepared. Every member of the practice team should know what his or her role would be in the event of an emergency. The dental surgeon should check the layout of the practice. He should ask himself, if there were a medical emergency, would dental equipment get in the way? Would staff have room to resuscitate a patient? He should be prepared for patients to collapse in awkward or inaccessible places. Toilets, for example. It's important to fit the kind of lock which can be opened from outside in an emergency. Dental chairs should be tested to make sure they're strong and stable enough to withstand the force of cardiac massage. The amount of give in the upholstery of the chair should also be borne in mind, should the need for cardiac massage arise. This chair is relatively firm. And there should be regular checks on other important items of equipment. You will need an airway adjunct, such as a resuscitator mask, which should be kept readily to hand. A vital item is a portable oxygen cylinder with reducing valve, flow meter, tubing, and face mask. You also need a means of ventilation, such as a self-inflating bag with face mask, that can also be used with an oxygen enhancement facility. Other airway adjuncts that might be of use are nasopharyngeal and oral airways. If a patient collapsed, it could prove vital to have suction apparatus on hand to clear any blood, saliva or vomit from the airway. Portable reserve apparatus should be provided in case the facility in the surgery fails or the patient collapses in another part of the practice. Of course, any piece of equipment is only as good as its weakest link. So make sure you have the correct connecting tubing and suction catheters, and that it all fits together properly. Cricothyroid puncture needles are used for making holes in the cricothyroid membrane if this is the only way of establishing the airway. Then there are the smaller items, syringes, needles, injection swabs, a tourniquet, cannulae, scissors, intravenous fluids, infusion sets, a sphygmomanometer, a stethoscope. Every dental surgeon should also have the right drugs for an emergency. They should be immediately to hand. He should be able to administer them, and the expiry dates should be checked regularly. A dental surgeon should also be familiar with the possible causes of collapse: fainting, upper airway obstruction, myocardial ischemia, diabetic coma, epilepsy, asthma, anaphylaxis. Whatever the underlying causes of collapse and specific treatment indicated, the object is to maintain an adequate supply of blood to the brain. The hypotensive patient must be lain flat. The unconscious patient must have his airway maintained. The apneic patient must have his breathing supported. The pulseless patient must have his circulation maintained. If everything we now know about being prepared for an emergency had been applied in this practice, the crisis at the beginning of the program would have been much better managed. Let's give ourselves the luxury of doing something we can't do in real life. Turn back the clock and start again.
Mrs. Webster, very glad we've been able to help. Yes, that's right. Thursday the 14th at 2:30. Righto. Bye-bye. Hello, Mr. Bradley. How are you feeling today?
Oh, I'm fine, thanks.
Good. Can I just get you to sign a form? It's 10:15, isn't it?
Yes, that's right. Yeah. Thank you.
And if you'd like to take a seat, Mr. Johnson won't keep you long. Yes, righto. Mr. Bradley, I'd like to go straight in.
Thank you.
Morning, Mr. Bradley.
Morning.
How are you?
Oh, mustn't grumble.
Wife and kids?
Fine, yeah.
How's the angina? Any worse than last time?
Oh, just the odd twinge or two. Nothing to worry about.
Have you got your pills with you?
Yes. Here.
Lovely. Can you put one aside, please? Thanks. Thank you.
Thank you.
Right. Just one filling this morning.
Just pop your bib on.
Thank you.
Have an amalgam tray, please. Thank you. Right, open wide. There we go. Upper right 6. Right, now, you will be able to tell us if you feel at all ill, won't you?
Oh, yeah.
Right, just try and relax. Now, number 2 for you.
Mr. Johnson, I think there's something wrong.
Are you alright, Mr. Bradley?
I feel a bit uncomfortable and I've got this...
Mr. Bradley? Mr. Bradley, are you alright? Just collapse, get the emergency kit. Arrested, get an ambulance.
Yes, and what's the problem, Mrs. Lawrence? I see.
Get an ambulance. Mr. Bradley's collapsed. Looks like cardiac arrest.
Mrs. Lawrence, I shall have to call you back. We've had an emergency here. Ambulance service, please.
Take it.
We have a cardiac arrest. I'm speaking from Edward F. Johnson, dental surgeon, 26 High Street, Broadwick, 0346 845 312. About 5 minutes. Thank you. 1, 2, 3, 4, 5. The ambulance is on its way. It's at 5 minutes.
Thanks. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. He's coming around. It's going to turn you over, Mr. Bradley.
What's your name?
Mr. Bradley is lucky. This team was prepared. Not only have they been well trained, their training has been reinforced by regular practice sessions at the surgery. This is the only way to make sure all staff are familiar with emergency procedures. Could your practice cope as well?